This week, we're going to be discussing implementation evaluation. Implementation evaluation is an important step in the evaluation, design, and planning process. Implementation evaluation usually comes in the early phases before we get around to designing the full outcome evaluation. Implementation evaluation's primary focus is not looking at specifically the outcomes of the program and whether they're achieved or not, the larger sort of social goals and objectives we're used to thinking about and we'll be talking about for the majority of the semester. Implementation evaluation focuses more specifically on the day-to-day actions and activities and the implementation and execution of these to ensure that the program is being administered appropriately before delving into finding out if the outcomes are being achieved. Process evaluation or implementation evaluation or program process evaluation are all the same thing. The chapter that you read for this week uses the program process evaluation term, but really they're interchangeable. As we said before, the goal and the objective of this step is to ascertain how well a program is operating. Ultimately, we want to know if the program is reaching its target population and whether its service delivery and support functions are consistent with the way the program is designed. This program design is going to be something that we map out in the logic model that we've discussed before and really look at the different elements of the program theory to ensure that all of them are being administered in the way that they're supposed to be and that the outputs that are established by either operating manual, mission objectives, the legislation that authorizes the program are really where they're at. So our focus is on this program and its operations, its activities, its functions, the performance of component part resources, etc. You see the different definitions here of implementation evaluation and how it differs from outcome evaluation, which we're going to talk about throughout the rest of the semester predominantly. Implementation evaluation is the systematic and continual documentation of key aspects of program performance that assess whether the program is operating as intended or according to some administrative standard. Typically, these administrative standards are found somewhere in documents and policy manuals that guide the program's actions. Outcome evaluation is the continual measurement of intended outcomes of the program, usually of the social conditions it's intended to improve. We're going to look at two different articles that we've read previously, including one new one for this week, that looks at and focuses on outcome evaluation versus implementation evaluation and where this unique difference lies. Implementation evaluations are really an important part of the evaluation, design, and execution process. We really need to understand the what of what we're evaluating, which means that the black box, also what we can see down here, the program itself operates the way we think it should. What that means is when we map out our program according to program theory or we create a logic model, it's fundamental that we check the different steps within this logic model to make sure they're all occurring first. One of the primary reasons for this is that in order to conduct an outcome evaluation, we have to know that the program itself is functioning the way that it is supposed to before we even get to the outcome part. Otherwise, we may ultimately end up wasting a lot of our time looking for an outcome that ends up not being achieved, not because the program is unsuccessful in achieving those goals, but because it's unsuccessful in being executed in the first place. So, when we look at program evaluation, we're concerned with what happens during this part specifically. The impact evaluation or the outcome evaluation portion that we're going to design and spend most of our time looking at moving forward in the semester really is essential, but it's also unnecessary and it's wasteful to get to that point without doing a comprehensive look at what's going on in this black box first. What that means is we have to better understand the process and assess if the day-to-day activities are really being achieved and executed during the process of day-to-day operations of the program. When we conduct an implementation evaluation, there's a number of approaches in order to actually execute the evaluation portion. One of the most common, or at least preliminary starting points, is an area called description documentation. Really, this is just about what happened. Sometimes we can look at observational methods, and we can really just do a good job of following the people who execute the program around, doing some observation ourselves, and really recording and annotating most of what's going on a day-to-day basis. This is, while basic, the most common and really starting point for the execution of an implementation evaluation. Discrepancy analysis is another process, and this is when we start to get into more detailed and nuanced examinations of whether or not the program is acting as it's supposed to. In discrepancy analysis, we want to compare what is actually happening to what the plan was. So if you have a policy set of policy guidelines, or you have an operating manual, we can read what the expectation is. So for example, if we have a program that provides job training preparation for people receiving social welfare programs, and the policy guideline sets out that each one of them over the course of a week should receive 6 hours of resume development training, interview prep, job searching, and networking training, things like that. We know that the standard is supposed to be 6 hours. It's very easy to follow then one person through the course of a week and determine whether or not they received 6 full hours of this training. If there's a discrepancy, then we can annotate things like whether or not they received all 6 hours. Did they receive 8? Did they receive 4? Relative to the 6 that was the guideline for what they were supposed to receive. What that also means is that we can start looking for other deficiencies. It may be the case that they received 6 hours of training. However, all 6 hours of training were focused and spent on revising and improving the resume process. While this may be beneficial, the guideline states that the 6 hours of training they should receive are supposed to cover a number of additional topics like networking, interview writing, and preparation, things like that. While they did receive 6 hours, which may be a benefit, if it's the only 6 hours they're going to receive support services, we can take away that the implementation really only trains people to write resumes, not execute the other number of steps that are required. This means if we have a program that's really targeted at helping people on social welfare programs receive jobs, they may do a good job of getting first-round interviews because they have a very well-written resume, but they may end up failing during the interview process because they never received any preparation to assist them in this part. So this discrepancy analysis is an area we really want to be concerned with and looking for what's supposed to happen relative to what actually happened and looking for disconnects between those two. Comparison of sites is another type of discrepancy analysis, however, where we're looking at different locations. So the Boys and Girls Club of America, for example, may operate in Southern California, and they have different locations around the downtown area. If all of the programs are supposed to be executed in a way that they're consistent across places, one first step we may be concerned with is looking at multiple different location sites and determining if everything's being carried out the same way. For example, using the previous social welfare and job training preparation program as a case, if there are different offices across the Southern California area or specifically in a region of Los Angeles, we can go from site to site and determine that at one location, an individual may receive 6 hours that covers all those different topics. In a different location, an individual may receive 8 to 10 hours of individual training in a week. At a different location, they may only receive 3 to 4 hours. If we look even further, we may find that the 2 to 3 hours is all dedicated towards interview preparation and job searching and networking. We may find that the location that covers 8 to 10 hours is only focused on resume writing and helping individuals prepare cover letters and resumes and things like that. So it's important that both what we think is supposed to happen does happen, but it's also important to understand that differentiation between how programs are implemented may be something that carries from one site to the next, and that the actual issue is unstandardized implementation of a program across multiple locations. So these are different areas with which we can start really understanding the process evaluation approach. Another topic is the areas of focus for process evaluation. So what specific things do we want to be looking at when we start to delve into the weeds on executing this process evaluation? The first is the target population. Every program or set of government services or nonprofit organizations typically has a target population of who they want to reach and provide assistance to. What that means is it may just be individuals within a community, so any resident of the county of Los Angeles. It may be very specific, and it may be single mothers who receive less than the federal poverty line's worth of income annually, who have at least 2 or more children and reside within specific regions of urban Los Angeles County. So it can be very specific or it can be very broad, but ultimately we want to start by assessing whether or not the intended population is being reached. What that may mean is also asking questions about who are the representatives and individuals who are getting services from this program. General collection of information about their demographic characteristics so that we can understand whether the people receiving the benefits are those that are the ones who ultimately are being provided services by the program. It also means asking questions about level of awareness and understanding if we find a program is supposed to help low-income single mothers in Los Angeles, and predominantly it is married mothers or single mothers who make much higher than federal poverty line amounts of income. That may not necessarily be a bad thing, but that does mean that our target population is not being reached. And we want to ask questions about, are they aware? Are we advertising at all? Are people in those neighborhoods, in those areas, cognizant of those services being available? Is there a problem in the implementation that even though the services are available, the single mothers who don't make sufficient income are unable to reach the location where the services are being provided? Or that there are challenges in just being able to access the services during maybe operating times, and that they're all open 8 to 5, but single mothers have to consistently maintain employment to support themselves and their children and aren't able to come take advantage of the resources and benefits being provided by the program. So all these are types of questions that we really need to ask and thoroughly understand in a more detailed way to assess if the target population a program seeks to achieve, seeks to help, are actually the ones being assisted by the program and the services. Delivery of intervention or activities ask questions about what goes on in the course of the program in the activities section of the logic model. So what are the activities that are being executed on a day-to-day, week-to-week, or month-to-month basis? How much of them are the recipients getting? So are they providing resume services, or are they just printing out packets of information and handing them out? Is it an individually tailored counselor who's going to assist editing a resume that a person already has or helping them to write one? Or is it a bunch of sort of tips and pointers that are compiled into a book that people can get? Are they receiving multiple hours of ongoing and continued counseling when they need to come back and revise and make changes? Is it a one-time, 1-hour workshop where they only receive preliminary benefits at the initial intake point of the program? That's it. Satisfaction is an important characteristic. So whether or not an individual may be receiving job offers or not, that may be dependent on the quality of the services, but it may just be a factor of dissatisfaction. And so one of the issues is that they are supposed to want to take part in continued and ongoing support services to help them get a job, but in actuality, the instructors are poor, or the material gets off topic, or most of the information is not necessary or applicable to the people who are in the program, or potentially it is so rudimentary and basic that people who have a basic resume and need fundamentally larger amounts of personalized assistance are not gaining any benefit. So they're not paying attention, they stop showing up, they're really not gaining anything because of the dissatisfaction level from the way that the program operates. So this is an important characteristic. And then measures of climate and context really takes into account these external factors that may play a role here. So one of those you mentioned before, looking at different availability of the program and the times and the locations. It may not be that the services are bad, or that they are not putting on workshops, or that the individuals who do show up are those that get some benefit out of the program. It definitely may be the case, however, that the external factors, like being able to get to the facility where the workshop is being provided, or it may be that the times that they're offered are not conducive to a much greater majority of participants being able to come and participate. Are there external factors at play where the information that's being provided is about writing resumes, and the information is somewhat out of date relative to where these individuals might be applying for jobs, or that it's about writing and mailing in a paper resume, and that's just an external factor where people are really at this point no longer even being able to mail resumes in. So there's a lot of different things, climate and context wise, that are less about sort of the interworkings of the program and more of these structural outside factors that are relevant. So Those are important elements of the process as well. And then lastly, the infrastructure element of the process, the logic model, really looking at the resources and the input. So things like, are there an adequate budget and staff and facilities? So every organization, every operation needs certain resources to be able to function. It may be that they have some, but an unsatisfactory amount, and that these are important elements that need to be considered. If staff are, if it's a public health program that's designed to assist individuals getting flu shots and preventing disease outbreak in an area, you need certain staff who are qualified and certified to provide either administer flu shots or provide different medical services. And if the only employees of the organization happen to not be nurses, but just be public health workers who can provide information but not provide medical services, it wouldn't surprise us that necessarily that they're not doing as much good as the program would intend to. Budget is always an important element, and when there's cuts in spending, resources are limited, and that we may not be able to do as much as we would always hope when we have full budget or the amount of requisite resources that we've requested. So that's an important characteristic. And facilities are always important. If you're trying to run an operation and people are crowded into a room that is overpopulated and people are uncomfortable and unsatisfied, if that means that there are not nearly enough space for people to get the resources available, if you need technological equipment to be able to effectively instruct individuals on the program and the information that they need, all of these things are going to get into the way and result in a less than desirable implementation of the program. So if we're going to successfully execute an implementation evaluation, we have to sit back and think about the methodology of how we do this. So the first and one of the more important ones is the document review process. What that means is we look at the organization, either government or nonprofit, records themselves and really start to comb through and look at the information that's available. Sometimes this means that we could be looking at applications from individuals who are receiving benefits from the programs or services now, and the data that they provided with regard to their demographic information, their income information. If we're looking at these questions of target population, then these are particularly areas we want to be concerned with. If we're concerned with resources and whether we have capable staff, then looking at current or up-to-date copies of staff resumes may be an essential element of this to figure out what their qualifications are, what their background and experiences is, and if they are expected to meet certain qualifications, whether that's certifications or education requirements and things like that, that also may be available for us in resumes that we can get. One thing when we're tapped for time and resources that's very important is really looking at data that's already being collected. Anything that the organization has available to them that we can get quickly and easily is always preferable if it can be used than having to collect our own information. So it's not always the case that everything that you may necessarily need is available and provided by the organization already. However, this is a much quicker and easier process if they already have information that we can use and that is beneficial for us to save on time. As I said, the biggest issue with this existing data is while some of it may be beneficial, there may be a certain amount of limited or missing information that we desire that is absent and we're going to have to get anyway. That said, if we can get even 90% of everything we wanted, we've cut the task in front of us down immensely by using existing data that's already available to us. One thing we're going to talk about when we move into the discussions of measurement and variables throughout the semester is the difference between quantitative and qualitative data. Now, both of them, as you can see here, primary quantitative data and primary qualitative data are really both important elements of they're important tools that we can use, and one is not better than the other, but they should both be considered because they have their different places that they become beneficial. The first one we see here under quantitative data, surveys. This can be surveys of staff, service of clients, service of administrators in the program. Ultimately, we've all participated in surveys and we're familiar in some way, shape, or form with what a survey is. We'll talk much more about these in future weeks. But these can be a strong benefit. So if we want to get a true picture of what an individual employee may do with most of their work hours, then giving them a survey that allows them to express kind of what they do and break down their time over the course of a given week. They shed some important information. If we want to know about satisfaction regarding program services, we can send out a survey to clients who participate in the program and ask questions about the different services and benefits they've received to find out whether they're satisfied as well with those different services. Time, number 2, is something that is also important. And this is simply just about counting time as a quantitative measure. So if, looking at the number of hours spent doing activity A or project B, counting the number of sessions that are offered of something, at 30-minute intervals and adding up the amount of time that's provided and available for that service. And then lastly, money functions in a similar way, looking at the total number of dollars that happen to be spent on a particular area of services, area of programming, how many dollars are spent on either staff resources or allocate, the budget allocation for, resume writing services versus networking programs, if most of the money is going towards access to software and database that individuals need, things like that. Lastly, the primary qualitative data section. This is obviously the non-numerical elements, right? So we've got our anything that's numbers up top, and then our non-numerical elements in our qualitative data. Observational data is very useful qualitative information, and this just comes from whoever the evaluator is or members of the research team being actively involved in watching what's going on and recording these things to make sure that we have some data and some information. So sitting in on a counseling session to see what type of information and advice is provided to individuals. Things like following employees around for the course of a work week to see what they are doing with their time and whether they say it's one thing and whether they're doing something else. Interviews is obviously the more formal process, and we'll talk more about these in future weeks, but doing individual sit-down conversations to collect data from program administrators, program staff. You may have the CEO of an organization who's not a person you can necessarily sit and follow around for the entirety of a week or two, but it may be useful to sit down with them for an hour and ask questions about their perspective on what they think their employees are doing or what the organization's primary objectives are, who they think their target population is, and whether that actually matches up when you start to delve into some of that demographic data that you get from existing client data. So an important tool that can be used is the interview as well as the focus group. So focus group, obviously we're going to learn more about, but this looks at having multiple people as part of a single conversation where maybe it's beneficial to have 6 or 7 staff members in a group together and then making sure that they're engaged in a conversation with one another and can be part of a collaborative discussion to learn more about what they all think their opinions are of who they're helping, what they're doing, and how their time is allocated. When conducting an implementation evaluation, it's important to know what types of questions you should be asking. These questions may vary depending on what type of information you're looking to evaluate. With regard to target population, these are just some examples that you can think about in terms of questions to ask to get the information that you might need. I think one specific sort of broad general question that you can always utilize is if I was a supervisor and I was trying to establish if my employees and subordinates were doing what they're supposed to be doing the way they're supposed to be doing it, what actions or questions might I ask to get that information? These are general examples that you can use as well here. How many persons are receiving services is a question you can ask in order to figure out both the target population information, the quantity of individuals receiving benefits. Are those receiving services the intended targets, which includes sub-questions about knowing who the target audience is, as well as what is the composition demographically of the people who are receiving services. So you may need information on socioeconomic status, education level, racial background as well, in order to basically be able to have the answers to these questions and compare whether you're receiving the target population. Are they receiving the proper amount, type, or quality of services? Obviously, the services element of this question is one piece, but also are the individuals if the certain populations should receive different types of services, then you want to know if what they should be receiving is being received by those different subgroups. So these are different questions, and I think the last one is also important that doesn't get asked enough, which is it's not just about the individuals who are receiving services, but are there people in the target population who are unaware, and if so, why are they unaware? Or are they aware? Because these are important things if we're trying to provide services to members of the community or different groups in the public, that we are cognizant of the fact that we need to be advertising and marketing in a way that those who are eligible for benefits are aware of the services that they should be eligible for. If we look at the different types of activities as well, we can see that there are other questions that we may ask to get a better sense of whether the activities of the program are being administered and implemented the way that we want. Obviously, we won't go through all of these, but you can look at these as you're thinking to yourselves about your own program. Questions like, is the staffing sufficient in terms of numbers or competencies for the duties that must be performed? Is performance at some sites better or poorer than at other sites? Are participants satisfied with the services that they've received? Obviously, these are all different types of questions that we need to ask in order to take a look at the implementation of a program and assess really if the activities that are being conducted are things that are being done the way that they're supposed to be done in a manner that is in accordance with either established policies that they should be implemented in accordance with. In the reading from the Rossi policy evaluation text, there's three types of identified implementation failures, and it's important to understand the uniqueness and the factors that contribute to each one of these, and to keep them in mind, because one of the biggest things that we need to be considered about as policy evaluators is the fact that these implementation failures are things that get in the way of the process and impede the program's ability to achieve the outcomes they want well before getting to the conclusion that the program itself is not something that necessarily leads to the outcome. What I mean by that is if you have a nutrition program that's designed to help individuals to eat better, eat healthier, and lose weight, one of the things we're concerned with as an evaluator is the fact that we need to know whether or not the program and all the activities that are associated with it ultimately do or do not lead to improvements in either physical health or eating habits and dietary decision making. The problem with that is that the other thing we need to worry about is whether or not the program is implemented successfully or not, because if it's not implemented the way it should be, then ultimately the net result is that there's a failure of implementation and it never had a chance of reaching the outcomes it wanted to in the first place. And these are the reasons we study implementation failures. Obviously, the first one that we have identified here is the no intervention or not enough scale implementation failure. Obviously, the basics to this is pretty simple in that if there is a program that's designed to provide services to reach some outcome, the treatment or the intervention itself not being provided in any way, shape, or form is a problem, and ultimately there's no way any outcomes will be achieved if the intervention is not delivered to the people who are supposed to be receiving benefits. Not enough scale is a different but related issue in the fact that if it takes a nutrition program roughly 20 hours of individual counseling to help develop a nutrition healthy eating plan, engage people in a routine exercise program, and to inform them sufficiently to have the skills to make wise nutritional decision making, then only getting 2 to 3 hours of that, while no intervention, is obviously an insufficient quantity of the program that people would need to otherwise get to the point that they achieve the outcomes they want. So they're similar in that they're related, and one of them obviously is complete absence, but the more common and more likely of concern is an insufficient scale of the treatment. That's a big issue. The second one that we look at here is the wrong implementation or intervention failure, also sometimes identified as being too complicated. So if a individual should be receiving job training services that help them write a resume, then a wrong implementation or intervention would be that they may be getting 4 hours a week of individual counseling and assistance, but potentially the person who's supposed to be helping them with their resume is really just sitting there having conversations about their dreams and their ambitions and their hopes and desires of where they'd like to work, not actually spending time helping them develop and write the resume. It could be too complicated as well, which are they may be spending the time with an individual career counselor who's supposed to be helping them with their resume. Ultimately, they're giving information that is so nuanced and so technical and well above the capability of the person they're trying to assist that the person who's receiving the benefit just ultimately doesn't understand at all the information that's being provided to them too. So both of these are related. Obviously, providing the wrong service is one failing where the individual is never going to achieve the outcome that we desire. It may be that there's some other outcome that results, but ultimately the right implementation of the right services needs to happen first in order to achieve the desired outcomes that we want. The too complicated issue is another concern, especially when we're trying to educate, we're trying to inform, or we're dealing with things that either are more technical or are instructed poorly in a way that people don't fully understand the information that's being transmitted to them, in which case it ends up being too complicated and they're unable to utilize any of the information at all. And the last one here is the unstandardized implementation. Obviously, the basics of this, and this is why we talked about the multiple sites question, is that a treatment, in order to be effective across a large population, if being delivered by different program sites, needs to be the same across all of the different programs. Now, being different across programs doesn't necessarily, or being different across sites doesn't necessarily mean that the program won't have an impact. What it does mean, however, as an evaluator, it becomes much more difficult and much harder to really understand the impacts of the program, because it's going to be more or less successful and potentially unsuccessful in different sites. And so what you're looking for is, out of 100 individuals, all of them to have a general improvement in a particular, let's say, overall obesity rates or total body weight or BMI should go down amongst a total 100-person group of participants in a nutrition program. If they're all receiving benefits from different sites that's implemented in an unstandardized way, some are going to have large gains, some are going to have average gains, some are going to have potential either losses or stagnant and show no improvement, which the ultimate outcome evaluation part means that we may end up concluding that our program didn't work, when in actuality it does. It just only works at the places that implemented in the standardized fashion that they were supposed to, and that these other unstandardized site locations resulted in bad data or erroneous data that resulted in our conclusions ultimately being wrong or suggesting that our program doesn't work. All three of these are important concerns and are reasons that a program may be failed or flawed in its implementation, and things that both as an evaluator as well as just a general administrator of government programs or nonprofit programs, we should be concerned with to make sure that we're doing everything in a way that's effective and satisfactory to people who are supposed to be receiving the benefits and achieving the outcomes we want. So looking at this last point, really what this is talking about, this goes back to our initial diagram we had on a previous slide, where if we're looking, we have a program, either nonprofit or government of some kind, which ultimately should be leading to an outcome that we desire, right? And this may result in a positive or a negative change in if it happens to be overall knowledge about how to get a job, then we want to see potentially an increase. If it's looking at overall body mass index, then we may want to see a decrease. But ultimately, it's a simple model of the program having the impact on the income. What the basic research model point above indicates is that obviously what we'll spend a lot of our time this semester focusing on is this outcome portion, and how do we design a research plan that will help us to evaluate whether or not outcomes of programs are being achieved, and that we conclude that programs work or not. However, in the implementation evaluation phase, we're looking at this specific bullet here, where we want to know what's going on in the predictor element, the program itself, that should lead to the outcomes we're interested in. So now that you've got a better understanding of what implementation evaluation is and how the process works and how to execute one, I want you to think over the two articles that you should have read by now, which include the Chen et al. Article on the garbage reduction program in Taiwan, as well as the Curran et al. Article for this week that looks at the obesity intervention program on American Indian reservations. And as you've read through these, I want you to think back and identify some of the answers to these questions that I'm posing for you here, which include this first one for the obesity prevention program, which are what actions were undertaken in order to execute the process evaluation. Remember, not the outcome portion, but the process evaluation for the store-based obesity program. In the article, they identify a number of different steps that were taken and actions that they carried out to determine whether or not the program is being implemented as required. And I want you to think about and identify these as we'll be discussing them in class next week. The second question is to focus on the outcomes and identify for the intervention that was put forth, what is the outcome or multiple outcomes that are specifically meant to be achieved as a result of this program. So you don't just execute programs for having no purpose. There's always some goal or outcome that we seek to achieve. And what they're talking about here is no different. Identify what those outcomes are. And in doing so, answer this last question, which is, anywhere in the article, do you find there's a clear evaluation plan for the outcomes specifically? So look through that, think carefully and thoroughly about it, and then make an assessment as to whether or not you see that there is a plan to evaluate the outcomes as well as the implementation portion. After you've done that and got your preliminary ideas down on paper, I want you to comb back through the Chen article on the garbage reduction program and ask yourself the two specific questions here. Right? What actions were undertaken in order to execute the process evaluation part of the garbage reduction program? So the implementation of the program has its own specific evaluation steps. What actions do the authors report having been executed to evaluate that process part? And then what separate but different actions are also taken to look at the outcome part? So there should be an outcome evaluation element to this article. I want you to think about what actions were taken and steps were part of the outcome evaluation portion. And so I'm going to give you a chance now to pause the webinar and then think through these and start getting your preliminary notes down on paper. And we'll reconvene after you unpause to look at what the answers to these different questions are. So now that we're back, we're going to look at the answers to the questions that I posed to you earlier. Within the first one, we're going to begin examining the Curran et al. Article, which is the one that looks at the store-based obesity intervention program for the American Indian reservations. The first question here was to identify which actions specifically were undertaken in order to execute the process evaluation portion of the store-based obesity program. And in the article, if you look in the first few pages, they identify a number of different items that are listed here. The first that's identified there was the store visit evaluation form. So one of the things that they did in order to evaluate the implementation of the program is they created a form that they used that was standardized and then used that form to go into the different stores and collect data resulting from an audit on a number of different factors. So this is observational data. Obviously, they created a general and standardized form in advance before they started doing the evaluations. And a member of the research team entered in the store and then began collecting information that was available about these different factors, right? The food availability and the appropriateness of the shelf labeling, the presence and the visibility of the posters and educational displays that should have been available, as well as whether customers received the flyers when entering the stores that they should have about the new program, the new labeling system, the food demos, and things like that. So this is one piece of information that they utilized in order to execute the implementation evaluation from a observational perspective within each store. Right? The second item here that they listed is this mass media log. Right? So they wanted to evaluate both the fidelity of the intervention, meaning we're going to look at the audio and visual communication materials that were used to promote the program in order to disseminate information about it so that people knew of the program and were aware of what was going on, and look at and make sure that they both went out as they were supposed to and that they were clear and understandable and communicated well in the advertisements and marketing information that they had produced. The third item here is the cooking demonstration and taste test observation. So again, they created a system for an observer to come in and record information to look at the reach of these programs, to figure out how many people and who those people were that were receiving the cooking demos and the taste tests. Right? This included factors that they had identified in advance, like the duration of the demonstration, the food and recipe that was being promoted, the number of participants that attended the demonstration, and whether or not they stopped by on their own or were approached by an individual. Obviously, The concern with the difference there being is that the individual's motivation to observe the demonstration is obviously preferable than someone recruiting them to come in, as well as information about whether they stayed a short amount of time or for a longer period of time. And so all of this was observational data that was recorded by another member of the research team. And then the fourth item here, a self-administered customer evaluation form. Right? This is a survey that they gave to people who participated in the teaching demonstrations of cooking and of food recipes, and really had them evaluate just their own reaction and whether what they had planned on using the promoted food or recipe for. So obviously this gets at questions of satisfaction. Did they enjoy it? Was it informative? Did they understand it? Do they plan on using the food product or the recipe that they learned? Things like that. And so all four of these in collective served as the actions that they created to perform an evaluation of the implementation of the program. The second question that I asked here is, what are the primary outcomes, right? Not the implementation evaluation steps, but the outcomes that the intervention sought to improve. Right? This should be intervention, not interview. I apologize. Right. So in that process, there are really one major thing with kind of sub-elements that they identify as being important. Right. Obesity being the primary outcome. Right. They talk in the first page or two about the overall challenges that American Indian communities face and how there are both genetic and cultural reasons for having issues with a westernized diet. And they talk about the problems of obesity on these reservations, and they mention that the different diet-related chronic diseases that are also of concern that disproportionately affect these American Indian communities. And they identify some sub-areas like type 2 diabetes, cardiovascular disease, gallbladder disease, joint disease, and some types of cancers. So obviously the program itself, these teaching demonstrations, this informational labeling system, all these different sub-elements of the program, while being evaluated in their implementation up in this first part, are designed to achieve something that we see here, which is an improvement in obesity. Right? So we go back to our simple two-dimensional diagram. Right? The outcome that we have here is the obesity portion. That is the outcome that we're concerned with, right? And the program, which includes a number of things, right? We talked about the black box. So this would be the teaching demo would be one of the items within here. The second one would be store labels as a second item, and all of these other factors that were part of it that should ultimately lead to a change in the outcome we want, which is a reduction in obesity. And then the last question that we ask here, number 3, is there anywhere in the article where there's a clear evaluation plan for the outcomes, right? They spend a lot of time talking about the process implementation evaluation. Do they have any development of a plan for an outcome evaluation? And if you had a long time struggling to find it, you'll see here the answer is no. Right? The outcomes are identified, and while they make a special note of what the issue is and why the program is important, this piece of research serves primarily to provide a process or an implementation evaluation of the program and provide the results of that implementation evaluation, not delve into whether or not obesity is actually reduced as a result of this program being rolled out. So what that means is, when they conclude, they say that the program was successfully implemented. This is something that it's important to know, and it's something that we're very much concerned with, but it doesn't say anything about whether this obesity or the other obesity-related diseases were reduced, the outcomes. All right, so we do this as a first step, and it's important for us to consider these factors as we do the implementation evaluation, because we want to know first, did everything go according to plan? Because if so, then we are able to move on to looking at whether or not there was an impact on obesity as a result of the program. But if not, we know that there's a failure of the implementation, and we need to go back and really point out the fact that the program is failing first, and that you're not going to achieve any positive impact on obesity levels if the program's implementation isn't fixed first. It's at this point now that we turn our attention back to the previous article that you read, the Chen et al. Article on the Taiwanese garbage reduction program. The first question that was asked here was to look at what actions, again, specifically, were undertaken in order to execute the process evaluation for the garbage reduction program. In this area, there's a number of identified actions that are spelled out in the article over the first probably 20 to 30% of the content. Obviously, the first one specifically here, we're looking at a program that's designed to both communicate new information, new policies about how the garbage collection in the area was going to be executed and things like that. And so there's a number of steps that were rolled out before ever getting to the point that we looked at any tangible impact on garbage production levels. So obviously the first here, visiting the sanitation department and examining government records to confirm the letters were sent. One of the big elements was communicating to the public in the community that there was going to be a change in policy, including collection dates, which would result in, I believe, Tuesday being the day that individuals were not going to be able to have their residential trash collected. So a simple way, if we think about how would you identify whether people were informed or communicated the proper information, is to go to the government records for the person who was supposed to send out the information and confirm that all of the letters that were supposed to be sent on the dates that they should have been sent were done so. And they find that in the evaluation article that it's the case that this did occur. The second step we have here is to review different newspapers to find articles that had reported on the program. So one of the other objectives was to increase awareness of the program, which resulted in different newspapers having either advertisements or reporting publicly about the change in policy and the process that would now be different in terms of garbage collection. A simple way of finding out if that would be done or has been done is to get copies of the newspapers, review them yourself, and then find out if they have reported on the program or not. The authors do find out through their research that the newspapers did report on all of the new changes, and so that it seemed like that was completed accordingly. The next step here was to walk through the city streets and find out whether the banners were visible and that they're displayed where they're supposed to be. So obviously another advertisement element of this program, which includes sort of these three steps here, which were looking to make sure that the letters were sent, ensuring that newspapers were appropriately reporting on the program, and then making sure that these large banners that hang over the center of town were displayed and were posted up for people to see, that they could be read legibly, right? So if the font is too small and people can't read it, then that's a separate issue, even if they're up. And if they're not up, that's a separate problem. And so all of that is important elements of the implementation of this program. So they went through town and they confirmed that the banners were up, that they could be read, and that as many that should have been out were placed where they were supposed to be. Right? Then we get into the next steps of the implementation evaluation, which looks at different items. Right? So we see right here, item A, we have enforcement officials who are supposed to be protecting the sort of dump locations to make sure that they're communicating to individuals that they're prohibited from dumping their trash on the Tuesday date now as a result of the new policy, and ensure that they're deterring individuals from putting that garbage into the collection areas on the days that they're prohibited from. Another element here on item B is to drive around and confirm that few dumpsters were placed on residential sites. Right? So this is obviously it doesn't operate in the same way that we're used to in the United States with our garbage collection. They actually have dumpster locations that are rolled out into residential neighborhoods on a recurring basis for people to put their trash into, so a smaller size type of receptacle in a community area. So one of the items here was to make sure that on Tuesday, when people would normally expect to see a dumpster to put their trash into, that they weren't able to do so because those had not been dropped off. So that's the second check that they put on the implementation there. All right, and the last one, item number C here, is that to cross-check data to confirm there's no likely dumping of garbage in the commercial locations. Right? Ideally, and they mentioned this in the article, ideally what you'd like to see would be that residential and commercial trash is separated completely, and so that you'd be able to just look at the general total and isolate the commercial garbage from the residential. Unfortunately, the bins are kind of communal, and so they're used for multiple purposes. So one of the things that they do here is they basically are taking total trash from these bins, subtracting out the total, I believe it's commercial trash, which should leave the amount of residential trash. And as long as we see the total amount of this, right, the residential trash amounts being less than it used to be on Tuesdays as a result, then they feel relatively confident that people aren't putting the residential garbage into these commercial ones, right? So they do that, and that's another final check to make sure that really when all these items are taken into consideration as a whole, they feel relatively confident that people are informed about the program, that they're aware of the policy change, that people are enforcing to make sure that no one is dumping their trash when they're not supposed to be, or taking it illegally into another location and dumping it in the commercial areas. And while they identify, right, some issues with this kind of mathematical process that they use to determine whether people are dumping in the commercial areas or not, generally they feel pretty confident in all of this collectively to suggest that the program is, right, implemented in a way that is according to how they'd like it to be done, right? The second question here that we're concerned with is what actions are undertaken to execute the outcome evaluation, right? So in this, right, we're looking at a garbage reduction program, right, which has a number of elements specifically, but the ultimate goal, right, is to reduce the outcome of, right, trash production for the city, right? And so we have these different elements. Obviously, the main intervention piece of the program is the having to keep trash in your home every Tuesday instead of being able to put it out, right? So we have these actions where we then turn our focus from, right, this implementation piece, which we have in, right, the first half of these points here, and we focus on the trash production part, where we look at a couple of items. And the ones that they focus on here, item A being that daily garbage data is collected from both the city of Nifu, which is where the program is being implemented, as well as a neighboring city, Nankan, which is serving as a control group. And we'll talk later in the semester about control groups, right? But there's really two purposes for this, which are, you know, if there are general increases in trash production across, or let's say general trash reductions across across the whole general region, it's not just the city of Nifu, then we'd expect Nankan, which is right next door, to see a similar reduction, right? So that information is useful to determine if the program itself is achieving the outcomes it wants. The second reason that they use it, which is pretty creative, is the fact that because the town is right next door, and you know, this may be walking distance away, the concern is that, well, if people can't dump their trash in commercial locations or in any of the residential places on Tuesday without getting fined, then they may be inclined, if they have a lot of garbage, to walk next door to the adjacent town that doesn't have these policies, right, dump their trash there, and then ultimately they'd see large influxes of garbage on Tuesdays because people are migrating from the town next door to dump all theirs off. So it's a two-part choice of a control group. Ultimately, they find in the conclusion that there's not really any issue or overflow into the neighboring Nankan town, and so what they do is they have daily garbage data that's collected over this course of time, right? So from March to October 1993, they're looking at, right, this ultimate outcome here of trash production, right? They're not looking at the implementation of the program anymore. They've concluded through this whole first portion up to this point that the program is being implemented successfully and as they've desired, and they turn their focus to, right, whether trash is being produced more or less as a result. Right, the conclusion, which is maybe not surprising but interesting in its own right, is, right, the implementation was a success. Right, the program itself was not implemented with any failures, and ultimately, upon analysis of all the data that they have, the big issue is that, right, what we call a flawed program theory. Right, having to keep your garbage in your house for one extra day is not sufficient for people to actually reduce the amount of garbage that they produce. Right, the analysis was done correctly, the evaluation was done correctly, and ultimately everybody basically said, and they have surveys with individuals in the article that they talk about that point to this, which is, you know, I just put the trash in my house and I waited an extra day until ultimately putting it back in the trash can on Wednesday, right? And so the giant spikes of Wednesday garbage result after the program's been implemented to show that people just, right, it dropped immensely on Tuesday because people weren't able to put it anywhere, and on the next day ultimately put it back out in higher volume than they had done previously. So ultimately that takes us to the last part of this, which is now that you understand fully both how to conduct an implementation evaluation, what it is, and you've seen some applications of it, you're responsible for doing the discussion post for next week, which is going to have you think through your own logic model on the program activities for the program that you've chosen and write up an answer to this question, which is, for the program you've decided on, determine 2 specific activities that would be part of an implementation evaluation and would help you determine if the program is being implemented properly. So what would you do in order to validate what is said to be done? How would you validate that it actually is being done? All right, so you can ask yourself any of the questions that are presented in earlier slides, including the one that I start with usually, which is, as a supervisor, what would I do during the day or at the end of a day to confirm that the people who work for me were doing what they're supposed to be doing and that they're doing it well? Right. So, for example, the discussion post example that I've been using throughout the semester so far, the CSULB nutrition program, there's a number of items here that I've identified that could potentially be activities that are part of an implementation evaluation. Starting with looking at advertising materials that are disseminated by the organization and validating that they were distributed visible and legible. Right? If they're promoting the program, they're advertising, there's marketing information to try to get people to come and participate, that it's essential that we take the steps to figure out that that information is being disseminated, the information that is sent out is clear, communicates well, it's understandable, all of those things that we care about and know are important for people to be able to get people to come participate in our program. The second here, looking at attending some of the informational sessions and observing participant engagement, as well as reviewing content that's being presented and the aptitude and the ability of the instructors. So if, for example, this nutrition program has sessions that are going to help people learn how to make better shopping decisions, eat better, engage in more well thought out exercise routines that are useful to help people lose weight and get better shape, right, then it'd be useful to have a standardized form that we take and we attend some of the different information sessions to make sure that the material is not too complicated, that people who are presenting are capable of presenting well, to make sure that the information that is being provided is relevant and on topic, and that people aren't either just goofing around or talking about, it could be an hour-long conversation about, how the football playoff games over the weekend went, instead of talking about sports and exercise and how that getting into a healthy routine of playing sports on a 30-minute a day, 3-day-a-week basis or something like that as an engaging and a fun way for people to participate in regular ongoing exercise. So you want to look, that might be an option to participate and do some of the observation as well. Looking at some of the observation, we might be able to get data about target population from either one of these two things, figuring out, is there demographic information about who did receive the information that was sent out, or if people sign up to participate, are there records on hand from the organization of people who come to these sessions to figure out, are they CSULB students, are they only freshmen, are they only seniors, are they graduate students? Any of that information that might be relevant to us. Right. A third option, and obviously you are only required to come up with 2, might be to attend and observe some of the individual personal training sessions. So if they have sessions to help individuals at the gym come up with an exercise routine, that may be worthwhile to drop in on some of these and observe to see what happens and goes on, to make sure that it seems like the people who are participating are actually getting a plan created for them that they can stick to and that's relevant. Right, same thing if there's group exercise activities, any of these other things, right? There's a lot of observation here, right? But remember that the observation is one strategy. You can think about surveys being an option as well. You might use potentially interviews, focus groups could be another option, right? And then, as always, secondary data, which means if the organization has data on hand that is relevant about who signs up, who gets services, who they're providing information to, any of those things that might be collected and already be on hand that could be useful to you are things that you want to consider and take into account. So you'll also have 2 additional readings for next week that are listed there at the bottom as per the syllabus as well, and we will reconvene next week.